Hi everyone, welcome back to my YouTube channel. Today we are going to talk about Bell's palsy. We will start our topic with the introduction. Bell's palsy is a neurological condition that causes sudden weakness or paralysis of facial muscles, typically on the side of face. Now we will talk about the definition. Bell's palsy is an acute peripheral facial palsy of unknown cause. It occurs due to dysfunction of seventh cranial nerve, that is facial nerve, which controls facial expression, taste sensation, and tear and saliva production. Now we will talk about epidemiology of Bell's palsy. Talking about prevalence, Bell's palsy affects approximately 15 to 30 people per 1 lakh annually. Talking about age group in epidemiology, Bell's palsy most commonly affect between ages between 15 and 45, but it can occur in any age. Talking about gender, there is no significant gender predisposition in Bell's palsy. Now we will talk about the causes of Bell's palsy. The exact cause is unknown, but potential triggers include viral infection that may include herpes simplex virus, varicella zoster virus, and inflammation and swelling of facial nerve can also cause Bell's palsy. Autoimmune responses or impaired immunity due to stress, trauma, or illness can also cause Bell's palsy. Now we will talk about symptoms of Bell's palsy. Symptoms of Bell's palsy include facial weakness or paralysis that include sudden onset, typically affecting one side of face, difficulty closing the eyes or smiling, dropping of the mouth and eyelid. Also include other symptoms that are pain around the jaw or behind the ear. It also include increased sensitivity to sound on the affected side and loss of taste on the front two-thirds of the tongue, and also dryness of eye or mouth is also associated symptoms with the Bell's palsy. Now we will talk about the diagnosis of Bell's palsy, like how we diagnose it. Bell's palsy is diagnosed clinically by ruling out other causes of facial paralysis such as stroke or tumors. Diagnostic tools for Bell's palsy include physical examination that include assessing facial muscle weakness, and we can also do imaging in this case, like MRI or CT scan may be used to exclude other conditions. So basically Bell's palsy is diagnosis of exclusion. If we want to diagnose Bell's palsy, we need to exclude other conditions. So we can also do electromyography that evaluates nerve damage and recovery potential of that facial nerve. Now we will talk about treatment of Bell's palsy. Treatment of Bell's palsy include medications that may be corticosteroids to reduce inflammation and swelling of the facial nerve if that is the cause of the Bell's palsy. And we can also give antibiotic drugs that may be prescribed if a viral infection is suspected. For Bell's palsy treatment, we can also do supportive care that includes eye protection, as like eye artificial tears and eye patches can be given to prevent dryness and injury to the eye, especially on the affected side. And we can also give physical therapy to stimulate facial muscles. Now we will talk about prognosis of Bell's palsy. Most people recover fully within 3 to 6 months. In rare cases, residual weakness or complication may persist. Now we will talk about what are the complications of Bell's palsy. The complications of Bell's palsy, if untreated, can lead to persistent facial weakness or asymmetry. It can also lead to synciness, that is involuntary facial movement. It can also cause eye problem due to incomplete eyelid closure. So this was all about Bell's palsy. If you like our video, don't forget to like, share, subscribe and comment. And thank you for watching.